Welcome, everyone. Thank you so much for joining us for part 2 of your COVID-19 questions answered. It's our 3-part speaker series, and a special welcome back to those of you who joined us last week for part 1, when our panel focused on your questions about testing. Today, in part 2, we'll talk about how COVID-19 will change healthcare. And as we wait for more people to log on, let me just share a few notes about how our format will go today. We'll be answering questions that were submitted by you prior to the session. The Q&A function in Zoom is turned on, so if you leave additional questions, we'll address them today, time permitting, of course, and then use them to inform our future session. I also want to mention that we continue to receive questions about testing and COVID-19 symptoms, and we've posted answers to frequently asked questions on our website at uclahealth.org, and there you can find a page devoted to COVID-19 FAQs. Also, our in-house antibody testing went live last week. We have other web pages dedicated to antibody serology testing, COVID-related clinical trials, options for video visits, and telemedicine, which I know we'll talk about more today, and an interactive map that shows all of UCLA Health's locations. So please make sure you go to uclahealth.org to find all of this information and much more. And it looks like that most of you have logged on. We have about 221 community members joining us. So let me say welcome to all of you and introduce myself. I am Judy Fortin. I'm Executive Director of Communications at UCLA Health. And as a former CNN medical correspondent, I am really delighted to moderate this panel of experts today. So let's get started. We have 5 esteemed guests with you to answer your questions. Johnese Spisso is President of UCLA Health and CEO of the UCLA Hospital System. Dr. Robert Cherry is Chief Medical and Quality Officer for the UCLA Health System. Dr. Eve Glazier is President of the Faculty Practice Group at UCLA Health. Dr. Gregory Hendey, Chair of the Department of Emergency Medicine at the David Geffen School of Medicine at UCLA. And Dr. Arash Naeim, Chief Medical Officer for Clinical Research at UCLA Health. Our topic is how COVID-19 will change healthcare. It's a big topic, and we'll get started with Johnese Spisso. As President of UCLA Health and CEO of the UCLA Hospital System, our audience would like you to address some basic questions about how UCLA Health is serving patients right now during this global pandemic, and what we're doing to help restart business in our communities. Good morning, Johnese.
Good morning, Judy. And Judy, thank you for this opportunity to connect with our community. And thank you to each and every one of you who is joining us from your remote locations for your interest in hearing more about our work at UCLA Health and for your continued support to us. In some ways, this global pandemic is bringing us closer together even while we're physically apart. So first and foremost, I want to let you all know that we are here for you and all of the healthcare needs that you may have, while at the same time managing the impact of the pandemic. Everyone should know that all 4 of our hospitals in Westwood and in Santa Monica remain open, as well as our 180 clinics in the community. We have worked hard to assure that patients and our staff are safe as we're providing care. We have trained everyone, we have adequate supplies of personal protective equipment, and abundant testing capacity. We have the highest infection control standards in place. We're using universal masking. We're taking everyone's temperature and symptom monitoring before they enter into our facilities. And we also have the ability to test all patients who come in for any type of procedure or surgery, so that we can safely now be able to reschedule patients who've been waiting some as long as 6 to 8 weeks for the surgeries and procedures that had to be previously postponed. We have opened our outpatient surgery centers, large facilities like our Jules Stein Eye Institute, all with these same standards in place. And we look forward to continuing the care, particularly to those complex patient populations who've been waiting, and also people who need their routine healthcare needs. We still have the ongoing daily ability to do video visits and telemedicine for those patients who don't need to be seen in person, but we really want to welcome back everyone for that essential care that they've been waiting for. So thank you.
Denise, thank you. So safety is one of our top questions that we've gotten today. And Dr. Rob Cherry, I'd like to turn to you next as Chief Medical and Quality Officer for UCLA Health System. I know that patient safety is always top of mind for you. So some of the questions we've received have been about medical or clinic environment. What is being done to protect patients and staff and make sure that all surfaces are cleaned between patient visits and it's really safe to come into our facilities?
Yeah, and that's a really important question, and thank you for that. I also want to say that it's part of a larger strategy too. And as you know, everyone in our community has been trying to flatten the curve and doing that on the behalf of health systems within Los Angeles. And the reason for that is that we don't get overrun with patients. Yet at the same time, we have to do our part too to make sure that we keep our healthcare environment safe so that our workers can execute on delivering world-class care as well. So part of the early strategies that we did to make sure that community-acquired infections doesn't infiltrate our doors is by making sure that volunteers, for example, that do a terrific job for us to say it's okay to be at home during this period of time. To also make some of the difficult decisions around saying, well, maybe we don't need so many visitors, but if you're a significant other and need to be there for a live birth, or you're a support for an individual with developmental disabilities, that's fine. But everybody else, just stay at home and be safe. At the same time, as Ms. Spisso has mentioned, setting up a screening process through all of our hospitals and clinic buildings so that they're being screened for temperature and symptom monitoring, and also monitoring their symptoms remotely so that if they develop symptoms, they can report that electronically, and we can also engage them in terms of what's the appropriate next steps for them. At the same time, we've also instituted universal masking within our clinics and hospitals as well to keep our staff and visitors safe. So anybody entering our buildings actually gets a mask. At the same time, we've also implemented, telehealth as a reasonable option for individuals, but also making sure that if you need in-person care, that's available as well. And to make sure that those that are working in our facilities are, if they need to be here, that's great, but if they can work at home and be safe there, that's fine. So we want to make sure that our facilities were safe, that we minimize the number of people that are actually inside, and that we're restricting it mainly to patient care and other essential support services. The other thing that we're also doing is making sure that for patients that are admitted with COVID-19 or have a high suspicion of COVID-19, that we're maintaining patient flow and isolation procedures that allow for everybody to be safe. And that's critically important to our care. Triage tents that you see set up out in the side of our emergency department is one strategy with that. Maintaining hot and cold zones within our facility to be able to have patients flow in an orderly fashion is another part of that strategy. In addition, we set up special COVID-19 units to make sure that we isolate those patients with special care teams that provide support and treatment for those individuals. And we've also made sure that our personnel is well protected by working with our existing vendors and other vendors as well to make sure that we have the personal protective equipment that are necessary for our healthcare workers to be safe. And finally, we've also, as you mentioned, we have enhanced disinfection and sterilization processes as well, particularly for high-touch areas like elevator buttons and computer surfaces and other areas. It's not that we weren't doing those before, but like many industries, including hospitals, we've enhanced those procedures just to make sure that everyone's safe and comfortable within our environments, including MRI machines, ultrasound equipment, et cetera. I think universal testing that Ms. Spisso has mentioned has been an important component in keeping everyone safe, so we know who we're dealing with. So all of our patients that get admitted to our hospitals undergo universal testing, whether they're going for a procedure, for surgery, whether they're a direct admission, a transfer into our hospital, they get a test so we can separate those that are negative from positive so that they can flow within the hospital in a way that's safe for everybody that's involved. And so, all these things combined, in addition to those disinfection procedures that you mentioned, is part of an overall strategy to create, a safe environment for our patients, our staff, and our visitors.
Excellent. Thank you, Dr. Cherry. We have a question about emergency care. So Dr. Greg Hendey, I'm going to turn to you for this answer. As chair of the Department of Emergency Medicine at the David Geffen School of Medicine, you've seen the impact of COVID-19 on the emergency room directly. So is it safe for people to come in for their emergency needs?
Yeah, thanks, Judy, for that question. It's absolutely safe to come to the ED. It's safer than ever, and it's faster now, too. Our highest priority is the safety of our patients and of our staff. From the moment you arrive at the ED, even before you enter the building, we do a COVID risk assessment, and we offer masks to patients, and we separate those with COVID-like symptoms, fever and cough and so on, so that we can safely care for them in one part of the ED while not exposing our other patients, many of whom are immunocompromised. In addition, our entire staff, as Rob and Johnese pointed out, are doing daily symptom monitoring to make sure that we stay healthy. And we check the temperatures and symptoms of everyone entering the building, and we COVID test every patient admitted to the hospital. We've spent literally hundreds of hours preparing for this to make our ED safe and efficient. We've redesigned all of our processes to minimize exposures, and we use PPE, or personal protective equipment, throughout the entire ED. And there's usually no wait now to see a doctor. So our clinics have also done a really great job of meeting the needs of our patients so that most don't even need to come to the ED. But we've also seen something that's a little surprising and something that's a little worrisome. The overall number of patients coming to the ED has been far less than usual, and that's understandable. People have been following the stay-home order, and I'm sure that some patients with less severe problems are staying home instead of coming to the ED. But the concerning part is that we've actually seen fewer strokes and heart attacks in the past 2 months than we did before. And I don't believe for a minute that these disorders are any less common. But my fear is that people with mild but concerning symptoms might actually be staying home when they should be coming to the ED. In other words, patients with mild chest pressure or weakness on one side might actually be having a heart attack or a stroke, and they're not coming in to get the emergency care that they need. So we've definitely flattened the curve of this disease by staying home since mid-March. But we don't want people to take that to the extreme where they could damage their own health by not seeking the care that they need for their non-COVID related medical problems. Thank you.
So call 911 if you feel like you've got an emergency and seek that care.
Absolutely.
All right. So I'm glad we talked about emergency care. You also mentioned the clinic. So I'd like to turn to Dr. Eve Glazier because we've received a number of questions about routine care, like a physical or colonoscopy or mammography. So Dr. Glazier, as president of the faculty practice group at UCLA Health, what guidelines should people use if they're overdue for a routine medical appointment, or maybe they've postponed it over the last couple of weeks?
Good morning. Thank you, Judy. I really appreciate the opportunity to answer such an important question. As you all know, and Ms. Spisso and Dr. Hendey mentioned, since late March, due to this pandemic, the CDC has recommended the delay of routine and elective visits to both mitigate the spread of the virus, but also to preserve protective equipment like masks and gowns. In addition, our state and local governments work together to mandate stay-at-home orders to support that flattening of the curve, which we have been doing. The deferral of healthcare services has been essential in response to prevent a surge, but it has really posed its own serious public health impact, and it's important that we address it as soon as it's practicable. There's been understandable fear and confusion, and with that, growing evidence that patients are not visiting healthcare facilities as they need to, just as Dr. Hendey was mentioning with emergency room care. But they're also avoiding their doctor's offices, and they're not getting important screenings and checkups. As an example, vaccine administration for children has dropped about 75%, and screening for breast, colon, and cervical cancer has dropped 94%, 86 and 94% respectively in March compared to the average before COVID-19. This lack of preventative care puts Americans at much greater increased risk for other medical conditions or worsening of their own medical conditions and even other infectious diseases. And we have major concerns that without the resuming of routine preventative care, that we might even see higher disease incidence and later stage disease at the time of diagnosis in the months to come if the screening rates continue to be so low. So one very important focus of navigating life with COVID, and I would even emphasize thriving with COVID, will be the thoughtful and careful resuming and prioritizing of routine and preventative health care. And that includes primary care, specialty care for those chronic medical conditions. Behavioral health care is obviously extremely important, labs, radiology, pharmacy, and of course, dental services as well. So in terms of guidelines, first and foremost, I want to strongly encourage all of you that the first person to turn to for definitive guidance is your primary care physician and or your relevant specialist. They will absolutely be the best advisor to recommend what screenings and care you may need and that are most important for you, when and how to obtain that care within the context of your own individual risk profile and risk category, all balanced by the needs to comply with state and city regulations and rules, and of course, keeping you as safe as possible. I want to mention that, from some of our academies and medical societies, yes, the American Academy of Pediatrics, they actually just published new recommendations last week recommending that pediatricians identify children who have missed any well child visits, any developmental screenings or vaccinations, and bring them into the office as soon as possible, and reminding them that immunizations are essential services. The American Cancer Society, they were supporting the deferring of routine cancer screening for at least the month of March and April for those patients that are average risk. But again, they stress that for those who are at high risk or for those who don't know their risk category, to speak with their doctor to see if they need to prioritize screenings now. As Ms. Spisso mentioned, and Dr. Cherry and Dr. Hendey, we've been working across the health system to create the safest environment for our patients to receive care and for our staff and physicians to provide that care in. So in terms of how we're approaching routine care, all of our more than 100 medical practices are open. Our procedure units are open for colonoscopies. Our radiology units are open for mammography, and all of them are following the most rigorous infection prevention policies, including, as we've said, universal masking, pre-screening protocols, and physical distancing practices. Importantly, in the clinics too, we're focusing on really examining, revamping our scheduling matrices, check-in and rooming processes, waiting room and exam areas to optimize our ability to allow for that safe physical distancing while steadfastly using appropriate and recommended PPE. So as Dr. Hendey said, not only do we believe it's safer more than ever for our patients to come in and receive essential and routine and preventative care, we highly encourage that you do. And as I will be mentioning later, there are still many visits that can be safely and effectively done through video visits and telephone calls. So again, I do recommend most of all that you touch base with your doctor to determine the type of visit that's best for you.
So Dr. Glazier, let's talk a little bit about telemedicine.
Sure.
Interesting. I think in the last couple of months, it seems like telemedicine has probably advanced by a decade or maybe even more just because of necessity. So how important is telemedicine in our ability to deliver care at our 180 plus clinics around Southern California? And what improvements need to happen in that technology to make this really useful and fully accessible to so many more people?
Thanks, Judy. No, that's a terrific question, and it really has been transformative to see. Disasters and pandemics really do pose these unique challenges to healthcare delivery, and it has been incredible for us to see, but also critical to the delivery of care to our patients, that we've been able to use our telehealth tools to connect with our patients and continue to provide our outstanding high-quality care. We're very fortunate because we've spent the last few years building a robust telehealth infrastructure, which hasn't just prepared us, but really positioned us for a swift and nimble, widespread and exponential, like you're saying, a decade advanced adoption of our telehealth tools. And by that, I really mean video and telephone visits. But for reference for everyone who's joined us, pre-COVID, we were completing about 400 televisits a month, really in more of an elective space. And now we've been doing more than 2,500 a day. And this is across all of our specialties. I mean, as you can imagine, certain specialties lend themselves more easily to virtual visits, but we've been using it for telemedical screening for COVID symptoms, everyday primary care issues, psychiatry visits, and everything to post-surgical wound care. And we've been expanding the use for our patients who are unfortunately in isolation on our nursing units to connect with our providers, and even for our other most vulnerable patients who are in skilled nursing facilities. It's interesting, the televisits have an exceedingly low no-show rate, which is terrific, a very high visit satisfaction, and thanks to parity and reimbursement with in-person visits, in addition to relaxed rules to provide this service across state lines, we're really able to reach as many of our patients as possible. So yes, and wonderfully, I think telemedicine will become a regular part of patient care in the future. I don't think it will be a substitute, but for sure it will be a complementary modality and not mutually exclusive with inpatient visits. You might have a hybrid model of doing part of your visit by telehealth and some of it in person, but we're really refining the role of telehealth and the entire digital patient experience to make sure it's for the right patient at the right time and for the right diagnosis. But we've been so fortunate, to really already have this robust telehealth infrastructure and an amazing connected health team. So our technology has been comfortably in place, and then we've been able to scale it, and we'll continue to mature it. But it's a very exciting and very evolving landscape.
Terrific. Dr. Glazier, thank you so much. I'd like to bring Dr. Arash Naeim into the conversation. He's Chief Medical Officer for Clinical Research at UCLA Health, and I know that you've talked about short-term, medium, and long-term research that needs to be done to support safe re-entry. So what role does research play in reopening our communities and providing better treatment options going forward?
Sure. I think it's really important, for people to understand that for a good number of patients, participation in clinical research or a clinical trial is their main form of care. And so, UCLA Health, both on the inpatient and the outpatient side, has really made a priority, even during the closures in the last couple of months, to ensure that patients for whom their participation in clinical research provides immediate benefit to them can still get access to continued participation in those studies. There have been some studies that have been temporarily placed on hold. Not that they're not important. In fact, they represent great science, will ultimately lead to new discoveries and treatments, but for which there isn't the immediate benefit to the subjects that made it worth the risks of bringing them in to participate over the last couple of months. Gradually, of course, we'll be re-involving those studies, reopening access to those studies, mainly due to the investment that all of the previous speakers have made in terms of ensuring that there's adequate protection. And by protection, we mean not just protection to the people that are participating into the studies, but the research staff that are also involved in providing the care in that sort of clinical research. In order to be able to do that and to support providing clinical care through research, we've had to use the same innovations that we've been just talking about. That includes being able to remotely consent people through electronic consenting, or to do research video visits that leverage a lot of the technology that Dr. Glazier just spoke about, to be able to do remote monitoring, or even deliver oral medications by sending it to their homes rather than having people to come and pick it up. And by allowing us to be able to do things in a more innovative way, we're able to continue to provide care to this very specific population. Our interest is really to be cognizant that a lot of the patients that are on these clinical trials represent vulnerable patient populations. They may have cancer, they may be immunosuppressed, they may be older with a lot of medical other sort of coexisting conditions. And our obligation to both our patient population and to those that are participating in clinical trials is to ensure that we can give them the highest level of care, whether it's routine care or while they're on a clinical trial as possible. And it's only by working collectively with all the people that you just heard from in the emergency room, on the inpatient setting, in the outpatient setting, that we're really able to do that. I think where we've shown our greatest strength is that in response to the pandemic, we have opened a lot of clinical trials that are specifically focused to COVID, both on the inpatient side, but more importantly in the outpatient side, because we know a large proportion of people that get tested for positivity for COVID don't end up being admitted to the hospital yet, but may have opportunities to participate in outpatient clinical trials, as well as showing that we can work very collaboratively with the county on surveillance projects, as well as with our other sort of academic contributors, like, for example, the engineering department, in terms of trying to figure out how to do really innovative approaches towards swabs for tests, protective equipment, ventilator parts, and we have a whole biodesign program that's doing a lot of innovative work that crosses medicine and engineering. So I think, you know, these opportunities, these sort of pandemics test our ability to get together and work as a community to serve our patients and the subjects. And I think, you know, from what I've seen, people have really stepped up to the challenge. And I think we'll be able to continue to do that and provide the best treatment options to our patients in the coming months.
All right, Dr. Naeim, thank you so much. Such inspirational research that I think will lead you into the future. You'll have plenty to keep you busy. Speaking about the future, Johnese Spisso, I'm going to put you on the spot here. In what ways do you think that the pandemic is changing the healthcare field for the better in the long term? I'm trying to look at the glass half full here.
Well, thank you, Judy. That's a great question, and definitely one that we're seeing the benefits of each and every day since we began planning and preparing for the pandemic and rapidly having to evolve some of our practices. So first, I would say one of the great things that we've done is really educate our public on how viruses are transmitted. And that improved knowledge of the public will serve us in this pandemic, in any pandemic, and in any general flu season. We've really done a good job, and I think the public should be commended for their adherence to everything that they've done for the stay-at-home orders, for the hand washing, for covering their cough, for masking. That's greatly reduced the spread, and we're seeing those effects definitely in Los Angeles County. The second thing I will say is that as we've evolved to doing more care remotely with telemedicine and video visits, we hope those are here to stay for patients who can actually get their care done more conveniently in that aspect. So we plan on continuing those best practices for the future. And then finally, I will say, we all have really learned the importance of working together, not only within our health system, but seeing our health system as part of the larger community, working closely with public health, with the county, with the state, with the federal government, so that we can work together and advise on policies that help keep people safe.
Excellent. Thank you so much. Dr. Cherry, not only is Johnese Spisso looking at a silver lining, but I bet that you are too from your vantage point. Will there be positive outcomes from this? And honestly, where do you think we're going to be 6 months from now? Can you predict or look in your crystal ball?
Yeah, I get a lot of questions about the crystal ball, so I'll be happy to prognosticate on that. I do think, though, that people will become increasingly more comfortable visiting clinics and hospitals to seek out their care. As you heard, a common theme is that we want people to do that. We don't want people to suffer needlessly at home or defer or delay care that's necessary, because the impacts on that are quite significant to one's personal health. I do think, though, 6 months from now, a lot of the things that we currently see will still be in place. I think hand washing, social distancing, masking, I think are part of our future over the next 6 months. I think there's also a good chance that, this could be, have a seasonal component to it. A lot of people do think that there could be additional coronavirus infections, during the fall, concurrent with the flu season, and we are preparing for that. This does put an additional strain on health systems as we're trying to differentiate then between, flu versus coronavirus. However, I do think there'll be improved treatments by then, both in the preventative range as well as for those with moderate and severe symptoms. So I'm cautiously optimistic that we'll see better treatments that are currently out there. I don't think we'll quite have a vaccine, 6 months from now, but I think there will be a lot of promising candidates on the horizon. So I do feel quite optimistic about that. And I think in our personal lives, we'll find ourselves, working differently. We'll be on WebEx and Zoom and Microsoft Teams. I think that'll have an impact on our social lives too, in terms of how we interact socially as well through new technologies. And even as an academic medical center closely aligned with the university, we'll see education start to change as well. There'll be more remote learning, and we'll start to rethink what that actually means, particularly for children who are coming up and thinking about going to college and selecting out universities. Does the SAT have the same value and impact moving forward because of remote learning? So I think we'll see some interesting changes over the next 6 months, many of them quite positive, but I do think we still still need to remain very cautious and vigilant and exercise the safety precautions that are being communicated out there.
Thank you, Dr. Cherry. So many of our community members are trying to figure out how to navigate just day-to-day lives right now. So Drs. Hendey and Glazier, I've got a couple questions that might interest you that maybe you can jump in. So here's a basic one. Is it safe for people to begin to see their grandkids and their friends? Dr. Hendey or Dr. Glazier, either of you want to tackle that?
Yeah, I can start on that, and then Eve can give the right answer. I think that it's fine to do that as long as we use common sense. We just have to be really careful about, that we know the virus is still out there, and so we know we have to remain careful. COVID, the severity of infection with COVID, we know is very age related. So in young, healthy people, the huge majority, even if they get a COVID virus infection, it is usually very mild symptoms and very few need even hospitalization. So, but we know that with every decade past the 20s, the risk starts to go up. So I think if you use some common sense in what you do and who you see socially, meaning that if you are very old, or if you're thinking of visiting a very old person or someone with a lot of underlying medical conditions, you have to really think twice about that and be more careful. And really be conscious of your social distancing and isolation, and not, you may have to give hugging and shaking hands and, all those sorts of things. But so I think the short answer is I think it's safe as long as you use a healthy dose of common sense.
Dr. Glazier, do you agree? Anything to add?
I do agree, and that definitely was the right answer. And yes, I would just emphasize, I think a lot of people ask us as well about COVID social bubbles, and when are we going to be able to do those? And I think, again, it's a lot of common sense, and it's a lot of transparency and honesty with your friends and family. It's going to really take a lot of caution and thoughtfulness to say, you're my social bubble, but how much does my social bubble overlap with your social bubble? And everyone just really needs to remember that as the size of your cluster grows, so does your friend's cluster, or even your immediate family cluster, and the probability of exposure. So it's a sensible idea, but it really has to be balanced with how do you actually enforce it. And as Dr. Hendey said too, really evaluating the risks of those closest to you, and also figuring out how to stay connected, and being outdoors in outdoor spaces and using a mask. I agree. I think knowing, again, the exposures of your loved ones and your close friends will really play into how you make those decisions and individual risk tolerance assessments.
And I love one more thing, sorry. I love what you said about just being transparent about things and talk about it. It can be very awkward if you're, somebody that you normally would shake hands with or hug, but just talk about it. And you can even joke about it, like, okay, COVID bump, and you give them an elbow bump or an air shake or something. But just talk about it and be transparent.
So I love that you're giving this advice, because I think people want to know, are these things you do in your own life? So do you wipe things down? That's one thing. Do we have to wipe down our groceries and all of our services? A lot of people want to know. No one wants to take that question.
So I'll take that as a member of a family of 5 that is the designated driver and errand person for the family. I could definitely speak to that. Now there's not a need to necessarily go to the extreme of washing down groceries, but there are some people that feel comfortable doing that, and that's okay. So rinsing off and wiping down the plastic on grocery products, the packaging, that's certainly a good thing to do. I would be careful about using excessive amounts of soap and water on produce because that can really infiltrate into fruits and vegetables and cause sometimes people to be ill. You can just simply let things kind of sit for a little while too. Oftentimes, this virus will be inactive, after about 24 hours on most things, except for plastic, where it may take about 72 hours, but nothing requires, in most cases, an immediacy. But it's a matter of exercising, common sense, but there are ways of staying safe and still being able to enjoy your home as well.
Very good. So a couple questions from our chat function I thought I probably would throw in at this point. For Johnese, Spisso, or Dr. Cherry, any idea when our volunteers might be able to return to our facilities? Do we have any timetable on that?
So I'll start and Dr. Cherry can chime in. You know, we're watching that closely. Volunteers are such an amazing part of our whole patient experience, and we all miss them, not only our patients and their families, but our staff. One of the things initially when we enacted the policy to restrict that, it was done for a couple of reasons. One was to begin to slow any transmission, but the second one was preservation of PPE. Now we're really focused on getting our restart back in place. So we're watching that carefully. We'll try to get them back as soon as possible, but we really need to kind of gauge how we are with full occupancy coming back on speed. One of the things that we were able to do that I think we're so proud of is one of our hardest working team is our pet therapy volunteers. And those were greatly missed by the patients. So they actually did video visits. So you can actually, as a patient, schedule a pet therapy visit with your favorite pet therapist, and they will come in on a Zoom call. And that certainly brings a lot of smiles. But we'll keep everyone posted. Again, safety is our main priority. But with that, we just want to recognize the excellent service that our volunteers do for us.
Thank you, Judy. You know, it's a perfect segue. Oh, go ahead, Dr. Cherry.
Oh yeah, I was going to say I'd like to echo that as well. You know, our volunteers have really provided a great service for our patients, and I can tell you for our staff too. We definitely miss their smiles and their presence as well. You know, some of the decision to have volunteers not with us was made for us. I mean, many of them were students from our campus that have volunteered, and many of them had to actually go back home when classes went remote. But we also have to take in consideration that some of our volunteers are actually older, who also do have their own comorbidities to contend with. We want to make sure that they were safe as well. As we start to rethink, you know, bringing volunteers back in, we'll be paying very close attention to the guidance that the state and the county has, because as you know, there's a phased reopening, and we will be really very much in line, you know, with that guidance as well.
Excellent. Dr. Naeim, I want to bring you back into the discussion here and make sure you have a few things to say about these. These are uncertain times. A lot of people are wondering, you know, how they're going to, you know, pay their rent or get through, you know, paying your utilities. You know, they're very stressed. There are a lot of mental health issues that we're seeing. This is really for all of you. And I'm wondering what recommendations you might have for those who are joining us today about mental health resources, or where do we even start to get the help that our society is going to need as we unravel the effects of the pandemic?
Sure. You know, I think what was, you know, really interesting is, you know, we heard earlier on in this conversation that, you know, there are a variety of health maintenance related activities that people aren't doing, even people that are at high risk. And historically, we've always had a challenge for figuring out as healthcare providers how to communicate to patients what their risk is and how their risk should translate to behavior. And if anything, the COVID situation has increased that. How much risk is there when we go grocery shopping, or when we open our box from Amazon, or, you know, and the challenge, of course, that this demonstrates is that have a lot of uncertainty there, which is why even when you might ask a panel like ourselves, we may not know with a high degree of certainty exactly how much risk there is with each of those activities. We struggle with it in our own lives, with our own families, and oftentimes we don't necessarily always agree, even within households, how much risk there might be with something. And that level of uncertainty about not knowing exactly about whether you're doing the right thing or can prevent something is extremely anxiety provoking. And so it creates stress. In addition, Judy, to everything that you just mentioned about the economic climate, the job market, what the future holds, whether there'll be an extra surge, what will happen when we loosen restrictions. And so I think the mental health side of this, the stress and anxiety that we all face, both as healthcare providers, but also as people that live in the community, is pretty enormous. And we don't really realize it. And I think as we come out of this in the next month or two, and we take a moment to breathe, we'll have to appreciate the fact of what toll this has taken on us, but also, I think on our children who have been also dealing with a tremendous amount of stress, trying to learn in a different environment, and looking at us as their role models to try to figure out what cues that they should be taking in terms of how they should be looking at the situation. So I think it's tremendously important and will probably be a focus as we move forward.
Very well said. Would anyone like to add to those comments? I think it's such an important discussion that we really need to be having these days.
Yeah, it is important discussion. A lot of our focus has been on one's physical health. We're also concerned about those that really need our mental health services clinically as well. The same themes really do apply, is that those individuals, particularly in the ambulatory environment, who do need continued help and support, prescriptions and medications and consistent evaluation, those patients still need to be supported either in person or through telehealth options. At the same time, there's a lot of patients, a lot of individuals who are concerned about mental wellness as well. And often people will ask me, well, what's the best way to say, healthy and prepared in this particular environment? And it's not just about, exercise and good nutrition and getting proper rest. It's also about taking care of one's own mental health as well. There are resources available to help people navigate through, these difficult times. Our website, for example, does have resources that can help you in terms of being able to stay, mentally strong through the uncertainty that we're facing.
Dr. Hendey or Dr. Glazier, do you want to say anything about this? I think it's so important, as people who are on the front lines seeing patients directly. How do you counsel people to make sure they're mentally fit as well as physically fit?
Sure, I'll take a stab. And these are things I talk about with my patients, my friends, my families, and my colleagues, and that are helpful to myself, I think, during this entire time, which is, managing expectations, I think, is important. There's been an arc, right, to sort of when this crisis began, and thinking maybe it was just going to be this discrete episode, and now understanding that it's going to be here for a while. And so, sure, whether it's, the sourdough starter or learning a new instrument, but really, set some goals for yourself and give yourself a break on the Uber productivity. I think proactively managing stress is really important, prioritizing sleep, nutrition, exercise, and even creating new routines. I think especially now that the family's around, sometimes you can take advantage of, instead of the afternoons being so full with running around, or the day, now you can actually sit together and have some different kind of meaningful time. But I think being compassionate with yourself is very important, and with others around you, and just acknowledging what you're going through and just being with emotion as opposed to trying to avoid it. Maintaining connections is huge. I know how much my dad has loved to FaceTime every single day with us, and how not just meaningful that is, but I think really necessary and vital. And then managing the radical uncertainty, as Dr. Naeim was saying, and staying in the present. And as a healthcare provider, but again, as an everyday person, mindfulness and meditation can be very helpful. Just a couple other things. I think news hygiene. We talk about sleep hygiene, but news hygiene. Really taking a moment to make sure that you're not constantly addressing that feed of news and watching TV all day long. Sometimes that can really have deleterious effects. So putting some parameters around that, I think, is important. And lastly, I would say, I think getting additional perspectives. I can at least say for my generation and my peers, something like this has been the stuff of other generations and nations, and it's been very helpful to speak to other generations and other people to get their perspective of what it was like to live with polio or life before whooping cough vaccines, and people who live in other places that, that we're not always going to be here, but we can live and thrive during this too.
There's so many resources out there. And Dr. Naeim, I'd like to ask you to maybe help us to figure out, where do we start to become educated from good sources? What are some places where we can look so that we're filtering out some of the chatter that may not be relevant or accurate or helpful?
Yeah, I mean, I think as Dr. Glazier just mentioned, there's a tendency for people to, when they're really uncertain, to reach out everywhere, to get as much information as possible. And that can be potentially quite overwhelming. So I think, for our patient population, our community that comes to us for care, I think I would always recommend checking with your provider, checking with the people that take care of you, as the sources for health, at least related information. And then in addition to that, I think that, there are always good sources that are related to either the FDA or the CDC, reputable organizations at either the local, state, or governmental level that are really working hard to synthesize a lot of information and then to be able to provide it to the public. It's always more challenging, and I have a tendency to do this as well, to jump on Facebook or Twitter, or where there are a lot of peers or friends and family, where it's very easy to get a kernel of a piece of information without knowing where the source of that information is and how much trust and value to put on the pieces of information that you're getting, which make it really a lot more challenging to know how to piece together a realistic picture of what's going on and how to prepare oneself. So, I think trying to go back to the basics of who do you trust for your health information and how best to be able to integrate that so that people can kind of come up with the right sort of and sensible approaches in terms of how to proceed.
Well, I thought you were going to say turn to uclahealth.org. So great website.
That's a good one too.
So I'd like actually to have you talk about that a little bit. We instituted a really interesting, terrific chat bot. So when people have questions, they can go online. I mean, these types of tools become important to the community, and we are a resource. That's why we've got 318 members of our community listening right now. They are hungry for information and good source information. Don't you agree?
Well, this is Johnese. Yes, definitely, Judy. And, the reason that we put that website up and we update it every day is to try to sort through information for the public so that they can really see what's most relevant. I think the benefit that we have at UCLA Health of being an academic health system, we're so fortunate to have not only expert clinicians and whole teams of health professionals, but some of the best scientists and researchers in the world that are constantly looking at how we can combat this pandemic. And it's been really inspiring to see all of these great minds working quickly. I think it's what gives us all the most hope and promise that we are going to get through this pandemic.
I put you on the spot for that. Sorry about that.
No, that's
Yeah, I would like to, pivot a little bit on the website because it's really popular. We do get a lot of hits, and that chat bot that we has answers a lot of important questions. And I can see in our Q&A, there's questions and more questions about groceries, frozen foods, mail, and handling of money, and those are really important questions. I do want to emphasize, though, that the way this virus is transmitted, the most common reason is really person-to-person transmission through droplets. So hand washing, social distancing, masking are the most important ways to keep yourself safe. Some of these other things, yes, they may be contributors, but by and far, the main contributors through droplet precautions, particularly if you're close to someone, not wearing a mask, not washing your hand frequently. Nevertheless, I do want to answer a few of those questions because they are in the chat bot. But in terms of frozen foods was answered, was asked about. Now, yes, the virus can potentially, if it's live on a frozen food, potentially survive in a cold. But again, it's not the common way with which this virus is transmitted. The other thing was about mail. You can choose to open your mail at the same time. Just be careful opening your mail that you're not touching your face to your hands. And just use a designated area, open your mail, throw out the envelope, read it. Or if you want to have it sit for a day or two, in a basket someplace before opening it, that's okay too if it's not urgent. The question around money, again, it's an unknown form of transmission. We do hear other countries like China deep cleaning money, but that only lasts so long. As soon as it goes back into circulation again, I think if you're concerned, frequent hand washing or using alternate, technologies such as phones or chip technology to pay for things than actual cash and coins.
Thank you, Dr. Cherry, for addressing some of those questions. But they're important. I mean, this is the future. When we talk about the future for healthcare, it impacts all of us. We've had some terrific discussions today. We've heard some great information, and I'd like to give each of our panelists an opportunity to deliver some final remarks. And Dr. Cherry, if you don't mind, since you're up on my screen, why don't we go ahead and have you start with just some closing remarks for our people who are joining us today.
Yeah, well, I certainly do appreciate, everybody joining. Everybody's looking for information. There's a reason why they call it the novel coronavirus. It's because it's new, and we're all learning about it. But I do think that there's a lot of confidence that all of us have in healthcare regarding the basic measures that all of us need to do to keep ourselves safe. And I think if we're paying attention to those, we'll do just fine. But again, I really do want to underscore, the basic message is not to defer your care unnecessarily. If you need assistance, whether it's in a preventative care area or you're actually having symptoms and you have some concerns, please seek out medical assistance. What we don't want is for people to needlessly, harm themselves because they're feeling unsafe, when in fact our healthcare, we've done so much to make sure that our healthcare facilities are safe for each and every one of you. So again, thank you for joining. Do appreciate all of you taking time out of your busy schedules to listen to all of us.
Thank you, Dr. Cherry. Dr. Glazier, do you have some closing remarks you'd like to deliver for us?
Sure, thank you so much. I've just really remarked in the last few months, our healthcare system, among many others, have really demonstrated tremendous agility, innovation, but most of all, compassion in responding to this crisis. And that's been incredible to see. And that response has really provided valuable insight into best practices, I think, for all of us that will drive healthcare transformation. We do have to embrace the fact that how we practice medicine has changed. But we can also see this as an opportunity to innovate and think about how we can best utilize our resources and really continue to serve and care for our patients. More than ever, we've seen how precious the human connection is and how vital it is to preserve it. Thank you so much for having me as well. I really appreciate participating.
Thank you. Dr. Hendey.
Yeah, same. Thank you so much again for including me on this panel. I've been really proud the last couple months to be a part of such a great, highly organized response that UCLA has taken to this crisis. And we all realized early on that the ED was likely to be the tip of the spear of this thing. So we were the focus, a lot of the early discussions on surge planning. And because of that planning, we've made it through in very good shape. And more than that, we've even been able to create a roadmap for the future so that if and when the next crisis occurs, we're going to be even better prepared. I owe a lot of thanks to the amazing ED staff at UCLA, both at Reagan and Santa Monica. They have all stayed really committed and dedicated to taking care of our patients. Nobody went running away from this thing. And I want to thank the many people in the community that have helped us with their kind words and lots of great food, keeping us happy, healthy, and very well fed. So thank you. Thank you for that. People are starting to re-enter society now, and they're coming back to the hospital, which is good. I think you've heard that the major message from all of us today is that it's completely safe to come back to the hospital. And although staying home helped reduce the spread of COVID, it's really important to get the care that you need for your other medical problems, which in the long run may be way more important than your risk of COVID. Thank you.
Excellent. Dr. Naeim, your final thoughts?
Yeah, I would say, we're really fortunate in that UCLA Health invested a significant amount in clinical research infrastructure before the pandemic occurred. And this has really allowed us to be very nimble and open up a large number of studies. And, the impact of the investments that we're making in clinical research will ultimately be to find ways that we can mitigate the severity of the disease so that people's anxiety will hopefully be decreased on the road to finding, vaccines and other treatments that are more definitive. And I would just say, lastly, one of the biggest and most important components of our population are the healthcare workers themselves, who often end up being the ones that are tested and become COVID positive. And we are investing a lot of energy and time in monitoring them, providing surveillance to them, and developing treatment protocols for post-exposure sort of prevention, so that as those most important individuals in our community become exposed, that we can provide them the best possible care and treatment, because they're members of our family and our community, and we tremendously appreciate them. Thank you.
Yes, they are members of our family. Thank you, Dr. Naeim. Johnese, Spisso, your final word.
Oh, well, thank you. Well, first of all, I'm so proud of the effort by our leadership team, our faculty, our staff in really addressing this pandemic for our community. I'm also so grateful for the incredible support that we've had from the community. Many of you on this call, our board of advisors, Los Angeles businesses that have really made so many things possible for our staff, not only at the meals and things that Dr. Hendey mentioned, but donations that supported personal protective equipment, additional testing for patients. It's truly been remarkable. And based on everything that we know going forward, we feel confident that we are going to be able to manage this pandemic and serve the community. And most of all, I want everyone on this call to know that we're here for you and your families and all of your healthcare needs. Please feel free to reach out to us at UCLA Health, and we hope to be able to help you in the future.
Johnese, thank you so much. And thank you to all of our panelists and everyone who's with us today who submitted such excellent questions. Now, if we didn't get to your question, I encourage everyone to visit uclahealth.org/coronavirus. We've got the most up-to-date information. We mentioned that terrific chat bot that will help you sort and find answers to your questions. Again, that's uclahealth.org/coronavirus. And I hope that you'll join us for part 3 of our series, Your COVID-19 Questions Answered. Everyone who registered today will receive an invitation. You'll also receive a follow-up email with video links to today's event, as well as last week's speaker series on testing. So for everyone at UCLA Health, I'm Judy Fortin. We'll see you next time, and thank you very much. Goodbye, everyone.